we're gonna do the abdominal assessment today, and so we're gonna be the video, and then I consent to be like for education purposes for school only. And this is my Teresa, my sister.
Hi, my name is Teresa. I consent for filming education purposes.
And then the video also upload to the YouTube, so you can send to I'm gonna upload the video to YouTube just for the education only.
Yes, I do.
All right, so we start right now. So before I enter to the patient room, I had to wash my hand, provide the privacy for the patient, and then ask her, "Hey, how are you doing today?
I'm good, thank you.
Can you tell me your name, please?"
My name is Teresa Nguyen.
Okay, and your date of birth?
My date of birth is February 9, 1990.
Okay, so I check the correct for the patient, and I check that's the correct for the patient, and with your identification like the name and the date of birth of the patient. So right now I'm gonna start for the abdominal assessment for the patient. Before I do it, I had to ask the patient like, do you have any problem with your abdominal?
No,
Do you have any problem with the diarrhea, constipation, nausea, or vomiting, anything of that?
no.
All right, so that's good. So we go ahead and then do the assessment. So right now I got to position the patient on the spine position. So can you lie down for me, please?
Okay.
And then I also support for the patient for the foot. Okay, so try to relax. Okay, okay. Can you elevate your foot? Okay, I support for the pillow. Okay. So today we're gonna be accept for the abdominals. So I gonna expose your abdominal. Is that okay for you?
Yes.
Okay, and then during the assessment I gotta be see what's going on for the skin. After that I can do listen to your abdominal, and then I will focus with abdominal and also palpate. So during the procedure, if you feel any pain, let me know, and then we're gonna stop right at that time. If that's okay.
Yes.
All right, so right now can I expose you? Can you expose here, expose the abdominal, so we can expose
Yeah.
here, and then up to here. Okay. All right. So the first thing we inspect the abdominal, we see like abdominal is flat. There are no sign of anxiety. And then abdominal on the left and the right side, they they symmetrical. And then the skin is pink, white. There are no cyanosis. And also I check her sclera. There are no cyanosis sign. There are no sign and symptom of the um, liver failure, cirrhosis for the patient. After that, I'm gonna be listen to the abdominal. So I'm gonna start with the right lower quadrant, and then right upper quadrants, and then left upper quadrant, and left lower quadrants. Okay. So I hear the active bowel cell for full for four quadrant active bowel cell. So in case the patient who doesn't have any bowel cell, we can listen up to 5 minutes each quadrant to rule out like hypoactive bowel cell. But for her active bowel cell, there are not no hyperactive. Okay, and then after that, I gonna listen to aorta um, artery. So for aorta, we have to find the landmark, umbilicus here, and then on the top is xiphoid rosette here. So two in from the umbilicus on the left side, we listen to the aorta with the diaphragm and the bell. For the aorta, I don't hear any bruise. There are no turbulence sound, so that's it normal. And then I don't see any pulsation there, so that's good. There are no triple A like um, aortic aneurysm found out there. And for when we see the location for aorta, so on the one in from the left and the right, we're gonna listen to the renal arteries. left and right renal artery is no bruised and no turbulent sound. So that's normal. And then uh, we're gonna do listen to the iliac uh, artery. So verify the umbilicus, and then one in to the left below umbilicus, and one in to the right. We listen for left and right iliac artery with the diaphragm and the bell also. So the iliac artery from the left and the right side is no bruise, no turbulent sound. And after the iliac artery, we can do the femoral artery. So the femoral in around here on the triangle area. So on both sides, we can locate first, and then we listen to that. Hey, I'm gonna listen to the femoral artery for both sides. Okay.
Yes.
So I listen to for the bell for the femoral artery for both sides. There are no turbulent sound. There are no shushing sound. So that's the normal for finding for the patient. So after I listen to the abdominal, so right now I gotta be percussion to for four foreign. Okay, I go ahead and do it. So Miss Teresa, right now I gonna be percuss on your belly. If you feel pain and anything, let me know. Okay.
Yes.
So I will gonna be go ahead and percuss you. Okay. So I percuss like for quadrant is a timpanized sound. There are no so timpanized we found like no mass, uh, no objection there, and no enlargement um, of the organs there. And now I have to palpate for the liver. So for the liver, we have to palpate on the top of the breast, the rib case, go until the end to find out, and then when it turns to the tympani sound, so that's the um, ending of the liver expand. So I use my finger to two finger on the rib, and the middle one gonna be on the middle of the rib, and I palpate on down. So I found the landmark for the liver expanded, and then the landmark on the top for the liver. So now I'm gonna make sure for the liver expand with um, the tape. So from the top to the bottom, from the landmark is 7 centimeter. So the normal finding is 6 to 12. So that's considered too normal for the patient. So the patient doesn't have any enlargement of the liver. Okay. So right now I'm gonna be uh, percussion for uh, the sling. So uh, Mr. Risa, so I'm gonna be percut on the sling. In order to find out the percussion for the sling, we have to find the landmarks. So so on the on the auxiliaries, we have the anterior uh, line and anterior line for the auxiliary line, and that is we percuss down to the mid auxiliary line. Usually, the sling expand to the mid axillary line. If they expand up to the anterior axillary line, that's been the enlargement of the sling. So we start to percuss from the um, anterior axillary line first and go down to the mid axillary line. Okay, so I'm gonna be percuss here on this side, on the left side. And then I found out that's the tympani on the anterior axillary line. So that means like the sling is not enlargement. Okay, and then right now I'm going to be a percussion for the bladder. So we have to find the landmass to the belly button, the umbilicus, and then we pop it down. We see like any changing sound for from the tympani from in abdominal and go to if the bladder is full, it's gonna be turned to door. Okay, so I'm gonna do it now. So it go down and it's no enlargement of the no expand of the bladder. She just go to the bathroom, so they are on the way down. It's synchronized. Okay, so right now I can go ahead and do the palpation for the patient. I'm gonna be go to the live palpation first uh, to make sure the patient comfort. If in case that the patient have abdominal pain and really severe pain during the palpation, we're gonna stop the procedure right away because we don't want to rupture any organ for the patient. So right now, I can do the live palpation. Hey, Mr. Reza, I gotta be live palpate on your abdominal. Is that okay for you?
Yes.
Okay, if you feel any pain, let me know. So during the palpation, we touching the patient and we look at for the face. Sometimes we can ask the patient to bend the knee. That may help to relax for the abdominal. Okay, but see really relaxing right now. I don't need the patient to bend down. Okay, so right now I'm gonna palpate for the from the uh, right lower quadrant first. It's like you feel any pain.
No.
Okay, and then I go on the left upper quadrant. Do you feel any pain?
No.
Okay, and then I go to the um, left upper quadrant, right upper quadrant, and now I left upper quadrant. You feel any pain?
No.
And then left lower quadrants. You feel any pain?
No.
Okay, so that's good. So I didn't find any masses, any tenderness, any enlargement of the organs, or the gas, or the obstruction in the abdominal, in the lipase. Because she can tolerate the lipase right now, I'm gonna be the deep palpate. I use two hands. I'm gonna do the deep palpate. And again, if the patient feel discomfort, I'm gonna stop right away. Do you feel any pain?
No.
Do you feel any pain?
No.
Okay. Do you feel any pain?
No.
Again, do you feel any pain?
No.
So I do the deep palpate for pharynx from the left lower pharynx, go to the left upper pharynx, right upper pharynx, and then right lower pharynx. And then the patient no complaint pain, no tenderness, no masses, and then no enlargement and organs, and no sign of the hernia found. All right. So now I'm gonna be palpate for the liver. So for the liver, I use my left hand to be support, and then I palpate the liver on the right side of the patient. Okay. So right now I'm gonna be palpate on the liver on side. So I locate the costal uh, landmass, and then I use my finger to support the left and the right. Okay.
Yeah.
Okay. So the patient no complaint, and then I palpate the liver. It's smooth, no mass, and then no sign of enlargement. Okay. And again, I'm gonna be palpate on the other side for the sling. Um, we should not we cannot feel the sling on the right side because the sling usually on the rib case. So if the sling found easy when you palpate, that's mean like that's enlargement of the sling. So on this side, so I palpate the sling there on the top of the rib. It's smooth, no mass, and the patient did not complain the pain when I do it. So after palpation, uh, so we do to the special test for the patient. So for the first thing, I gonna be like the fluid sheet uh, from Dunnet. Uh, we check for the anxiety for the patient. This is a normal patient. She doesn't have any anxiety. But for the anxiety patient, like we gonna see the anxiety on the top. So we're gonna palpate from the tympani, like we palpate on the tympani and stress out to the abdominal. And then let the patient turn to the right side, and then we continue to palpate from the we find the landmark between the door and the tympani. We find the imagine line. They separate two cells, and then when the patient supply first, we find the line first, and then we ask the patient turn to the right side, and we also palpate. We see that the line is different, it's changing. That means the patient positive with the flu sheet, and then the patient may have anxiety. And if the light it continue like no change anything, this is normal. So I what we're gonna do right now to be uh, a percussion from the tympani to the door, and then we see the light. Okay. So I found the landmark here on the line here, door, and then on the top line, and then Teresa, can you turn on the on your right side on this side?
Yes.
Yes. Okay. So the line gonna be here, and then we're gonna be podcast again. So there are no donors on Tiffany sound. So I believe like she doesn't have any fluid enough or some mass or something. I see that on the Tiffany sound. So okay, so she negative for the blue sheep. She doesn't have anything for that. And now we check for the Murphy side. The Murphy side is we add the patient. Can you go back to your normal side, Spike? Thank you. The Murphy side is some we find the liver on the right side for the patient, and we use the finger like the C cup like here, and ask the patient to take a deep breath, and then we put on the right upper quadrant below the rib cage. Take a deep breath, and then when we put down there, and then ask the patient to exhale everything out. When the patient exhale out, the diaphragm going to be go down, and then with our hand in a deep palpation position, and then if the patient have the pancreas, if the patient have uh, the inflammation of the gallbladder, she gonna be complain of pain. So right now I gotta do for the Murphy side to make sure she doesn't have the Murphy side. Okay. So Teresa, so right now I just prepare to see that you have the rib cage here, and why don't take a deep breath for me, please, and hold your breath. Hold. Okay, and now exhale everything. Okay, so she doesn't have any feel pain. Did you feel any pain when you exhale down? No.
No.
Okay, so C negative with the Murphy side. So for the pancreatitis special test, so I'm gonna do like I do uh, um, the 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 so the posing side. That's mean like I rest on her left abdominal, and then the right abdominal is gonna be pain if she have the pancreatitis. So I'm gonna be like press down with my finger on the left lower quadrant and slowly to put it up. So in case with the patient who got pancreatitis, on this side, on the um, right side gonna be pain. She doesn't have any pancreatitis. And the last special test we're gonna do for the CVA tenderness. We check for uh, uh, infection of the kidney or the inflammation of the kidney or hydronephrotic or any problem with the kidney problem. So Teresa, can you sit down up and then you can you sit up? Yes. So we're gonna be I will expose you, sorry, okay? And then we're gonna be find the CVA area, and then we do the tenderness. Do you feel any pain when I'm doing that?
No.
No. Okay, so in case the patient who got the inflammation of the kidney, they have some problem with the kidney, hydronephritis. So the patient will complain of pain there. So thank you, Teresa, for joining me today. And then I really appreciate your time to join me. So the video we just do for the education. That's the ending of our video now. Thank you for watching.